Good afternoon, everyone. This is Dr. Baker Townsend, and I wanted to give you a course overview into women's health. And so I just wanted to kind of let you know what's going on. We have a whole lot going on next week, and I kind of wanted to walk you through the course, open the course, so you can start doing a little bit of the prerequisite material that's due for your class Monday afternoon. So we can start here on the home page. I will be teaching this class. Ms. Lisa Dothwaite will be our clinical person. She'll help us with simulation activities, and she also teaches this course. So here are the course objectives. So we have a lot of the information here, and it's just, being able to look at pregnant women and women in general, and be able to assist them through the lifespan. So you know all of your prerequisites and your co-requisites. We'll have class on Monday afternoons in Building 39A, room 1028, and that's this core classroom, and it has some great technology. There's lots of seating. Please, if you ever have any problems or you need to talk to me, email me at jabaker@unf.edu. Please do not use the Canvas link. I get so much spam through Canvas that I can't keep up with it. So please always email me at jabaker@unf.edu. I will have office hours on Tuesdays and Wednesdays. We can Zoom. And then I have an office upstairs, Building 39A, room 4086. So you are required to have the textbook. A lot of people say, Dr. PT, I don't want to get the textbook. I just want to use the PowerPoints. You will need the textbook for the readings. You'll need Shadow Health. We will be doing several Shadow Health assignments, and I know you've already purchased those. The current edition of the Student Handbook. And then your recommended text is the NCLEX examination, the HESI review. This will count for part of your grade when you take the HESI at the end of the semester, and we're going to look at that. Okay, so let's go on to modules. And if we go to modules, we can see that these three are due by Monday afternoon. Physiology of menses and reproduction. If we click on this, we can see it's a very short video, and it's just going back through what you learned in an AMP2. And you guys, this is, you take this quiz, it's once and done. You should get 100 on it. It's open book. It's not hard at all. And you already know this information. Conception and fetal development. This is just the function of the placenta, amniotic fluid, and I have a little tutorial for you here. You need to look at chapter 12 because this is again a review, and then you will take this quiz. You can take it up to 3 times until you get the grade you would like. I would not encourage you to do that, only because some people like to take the quiz later in the semester. I have it set, before your final exam is a review. So I have it set to keep the highest score. So, it's open book. Just answer the questions. It's not hard. And, just put in the quick work. It's 13 questions. And then the last one is fetal anatomy and physiology. This is just showing you your ligaments, where your bladder is, where your uterus is. It's just very simplistic and straightforward. And Kegel exercises with these muscles of the pelvis. You can take this quiz up to 3 times. And again, it's open book, so it should not be difficult, and all the information is right here. Okay, so when you have your first test, this is the testable information. This is your review. And so I put all the questions from the quiz right here for you. And then you put your answers right in here, and you'll know what to study for the first test for this information. Okay, guys, so I'm going to come back to the simulation lab because that's going to be on the 10th and the 11th. But what I want to go through is, let's go through the syllabus first. I kind of want to talk about the syllabus real quick. Sorry, Canvas is a little slow today. Could pull it down though. Let me pull it down real quick. All right, let's look at it here. Okay, so you guys, please again, do not email through Canvas. I should have taken this out. I need to strike that. Please email me at jabaker@unf.edu. I apologize for that. These are standard policies, standards of professional behavior. You guys, we've had some incidents of incivil behavior, and we will not be engaging in any of those practices. You can be removed at any time for any type of unprofessional behavior. Academic integrity code, there is just no cheating, period. Cheating, falsification, multiple submissions, plagiarism, abuse of academic material, or complicity in academic dishonesty is removal from the course or an F grade. So you guys, please do not share test questions, anything like that. It's all academic dishonesty. If you have accommodations which you need taken care of, I'm happy to take care of those with you. Make sure that you're registered and you let me know. Incomplete grades, of course, if you had an incomplete, you would have to do that through the university, but you would need to let me know as soon as possible. Civility and non-discrimination. We don't discriminate against anyone based on any type of factors, including age, race, base, religion, creed, ancestry, physical or mental disability, national origin, sex, gender identity, gender expression, sexual orientation, marital status, genetic information, HIV status, sickle cell trait, or veteran status in any type of situation. So you guys, you can always report to the EOI, Office of EOI, if you felt like there was a discrimination issue. Civility, we want you to be civil. We have a lot of inappropriate professionalism issues going on in nursing right now, and we certainly don't want to do anything like that. We do have an office for equity, diversity, and inclusion. If you have any issues, same thing that we were talking about, non-discrimination, we would want you to report there. Student health and well-being. So you guys are very stressed. So the student health services, we have clinical services there, which are physical, and then we can refer you to counseling, the counseling center, which is amazing. For any type of anxiety, depression, stress, and they have individual and group therapy. So we really want you to know that there are resources available for you. Attendance and conduct, you have to attend class. It's part of your grade. We saw some drop in our state board rates because people were not attending class. For my class, it is mandatory. And I expect you to take notes, pay attention, so that you can get the information that you need, for the class, for testing and for the NCLEX. Emergency response, if there's a emergency, we'll definitely give you some alternatives for class, and make sure that you have the ability to make up the material. So you have to abide by all of the health policies according to My Clinical Exchange and our nursing handbook. Minimal requirements for appearance in clinical practice areas. You have to have your badge, especially in women's services. Like, they're not going to let you on the unit without a badge because of the risk for infant abduction. And so if you don't have your badge, you should just turn around and go home. If you miss more than one clinical, you failed the class. You guys, if you miss a women's health clinical, I cannot get you back into another women's health clinical. You will probably have to do a med-surg clinical to make it up. So I just need you to go to clinical. If you're sick, I understand. You may have to do a med-surg clinical. I don't do case studies for makeup. It's important that you have the time on the floor. Student safety, and just use your good judgment and stay safe. Always make sure you wear gloves, universal precautions, wear your mask if someone's coughing, all of that. You guys are good with that. evaluation of the course, you have to have a 73 test average without the HESI. So you guys, this time we have included the HESI in your grade. And we'll talk about that. But the grades, you're going to have 5 tests for me. You're going to have 4 tests and a final exam. We're going to look at the weight here in a second. But those have to be a 73 without the HESI in order to pass the test. Lab evaluation and clinical is either pass, fail. And your instructor will be making sure that you can do all of the skills which are required for the lab, which are the simulation skills at a minimum. Math proficiency, you need to make a 95 on your math. In order to pass, you'll have 2 attempts, and this needs to be completed by the first week of school. Here's our required text, the APA, Loudermilk, UNF Nursing Handbook, and Shadow Health. And then, of course, the recommended text is the NCLEX Comprehensive Examination, and we will be focusing on the women's health portion. So here's our evaluation and learning methods. So you'll have 4 exams, they'll worth 10% each. You'll have a HESI exam worth 10%. And this will be a conversion score. So say, for instance, you made like a, I don't know, I had one person make a 1200, and that was a 99.8 on her conversion score, and that's what she would have made for the HESI examination. So it will benefit you to study and pass the HESI. The final exam is cumulative, and it's worth 25% of your grade. This is because the weight of a final with the previous comprehensive information is indicative of how you will do with the NCLEX. We will have quizzes and case studies. You may have pop quizzes. You may have quizzes that I put in because you're not comprehending something that's not on our schedule, and I put it on Canvas. You'll need more availability to understand what's going on. So sometimes I'll put a quiz on, and it's not in the schedule, and I'll put it on Canvas, and of course I'll send out a notification for you. We'll have adaptive quizzing. My adaptive quizzing is usually 100 questions, and it's pass-fail. So you need to make sure that you pass it. If you pass it, it's 100. If you fail, it's a 0. But I do have it on study mode so that you can make sure that you know the material and you use it as a preparation for your HESI exam. Class participation, attendance, professionalism, and civility in the classroom. Again, attendance is required. HESI's exams are required, and we'll monitor you to do those. I do have a rubric for professionalism and civility. I do want to show you this real quick first. This is what the American Nurses Association says about incivility, bullying. And bullying can come from the professor to the student, the professor to the professor, or the student to the professor. So incivility, bullying, and violence in the workplace are serious issues in nursing, with incivility and bullying widespread in all settings. Incivility is termed as one or more rude, discourteous, or disrespectful actions that may or may not have a negative intent behind them. The ANA defines bullying as repeated, unwanted, harmful actions intended to humiliate, offend, or cause distress in the recipient. Such acts of aggression, whether they be verbal or physical, are entirely unacceptable, or whether they were delivered by a patient or a colleague. These incidents not only have serious effect on the well-being of the nurse in question, but also their ability to care for the patients. And I have your reference right here. So I do have a rubric for the 5% for class participation in civility and in professionalism. So attending all classes, 100%. Time management, you're on time. You demonstrate self-responsibility. You don't call out, and you don't, not come to class. Always demonstrates a positive attitude, good personal presentation. Sorry about that. And traits for engagement, and communicates using clear, organized language, and effectively demonstrates a positive exchange of ideas to connect knowledge. Acceptable, that would be exemplary. That would be 100%, 100 for 5% of your grade. 50%. Rarely misses class but notifies the instructor before the absent, arrives late. Consistently positive without incivil behaviors, demonstrates a positive attitude without defensiveness, and then communicates effectively without harsh or inappropriate language. And then 0% would be missing class, less than 75% of the scheduled classes, arrives late, demonstrates incivil behavior, bullying, or acts of aggression per the ANA, and demonstrates poor communication and listening skills. I'm very respectful of you, and I just look for the same respect in turn. We've already talked about the HESI. So the HESI, we want you to score an 850. If you score an 850, you do not have to do remediation, and you do not have to retest. If you score less than an 850, you will have to retest, and you will have to complete the remediation. And remember, you get 10% of your grade is based on this HESI grade, the conversion. This is just some knowledge base. These are our course objectives, and this will just tell you what we're going to learn in this class. We will do some S-bars at clinical. We'll do some clinical focus sheets we'll review later, right before clinicals. And then these are all clinical focus sheets. I do want to tell you that you will have a 4-hour community experience which you need to engage in. And this community experience will be, it can be something you've already done. It's not volunteerism, though. It's engagement in the community. I have one where we do proactive period poverty. And so the problem is many women do not have funds for Mincy's products. And so we'll do a drive. We can write letters to manufacturers of menstrual products and see if they will give us the products. And then we separate them out, put them into bags. We deliver them around campus. We take them to schools with lower SES. We take them all over the place so that women feel comfortable that they have the products that they need. And then we'll discuss period poverty. But if you don't want to do that one, then we can talk about other ones that you can do. And then this and final is your nursing concepts evaluation for clinical practice. So you will turn this in to your clinical professor the first day of class, or first day of clinical. I apologize, the first day of clinical. And make sure you put your name, your IN number, and your faculty will put comments on here for you. You need to upload this the day that you finish clinical into the School of Nursing site that houses all of your clinical evaluations. If you do not sign it and your clinical person does not sign it, and this has to be a handwritten signature, it will be rejected from the people who manage the site. So please make sure that you sign it and you upload it so that you can move on and move forward. Okay, that's all for that one. Let's close that. This is just a baby, and you can see this baby presses on your colon and your bladder and your kidneys and your stomach and your liver and your lungs and your heart. Makes it kind of hard for everybody. All right, so let's go back to modules. So that was the syllabus. And here's the lecture schedule. It's every Monday afternoon. And then we're going to have test 1 in the morning before class. This is going to be in the computer lab in building 39A. You can see right here. Well, your class is in room 30, your class is in building 39A 1028, but this will be in our computer lab in building 39A on the 3rd floor. So you have, here's your test, here's your test, here's your test, here's your test, here's your HESI, and then your final exam. So this will tell you what our topics are, what your readings are, and feel free to ask me any questions about the schedule. All right. These are just your clinical schedules. I do want to point out something. These are continuing to evolve as people become compliant with My Clinical Exchange. I will continue to put people's names on here. But what I do want to show you is Shannon pointed out to me that you guys have class during this time. So we're just going to bump that accelerated group to 1 to 3 on the 11th after lunch, so that you can go to class, because you would definitely like to go to class. So that will be good. And so we will continue to update this. I'm not taking any more requests on the Sign Up Genius because this is what we have left. I'm just going to put you into these positions. So there are no preferences any longer. You're just going to, whatever, however Dr. Adams tells me, I'm just going to put them into the clinical schedules. Okay, I think that's about it. Accelerated students, clinical schedules. Here's our first class, our reading and our PowerPoint. But let's go back to what you have to do this week. So we talked about you're going to do these 3. You need to get these done this week. They're not long, but you have to get these done prior to the sim lab. You guys, this information, this sim lab, I know you're there 2 hours, but this is an 8-hour sim lab. And what counts as 8 hours is that you're doing this pre-work. So here is the maternal fetal assessment document. Let me show you this. I'm just going to kind of go through these real quick. This is just the PowerPoint, okay? And so you can look at it. It's just the PowerPoint. And then if we go back, I try to put everything in there. Here's some links that can show you what to do if you need a refresher. Here is the quiz. So this is a narrated PowerPoint that I have done myself that you just go through. Here is the PowerPoint itself. And then you take the quiz. It's got 15 questions. I have unlimited attempts, so you can do it as much as you want, but it's due by January 10th at 8 a.m. And it is worth 100 points, not just to pass your sim lab, but as a quiz in the class. So it's easy. It's open note. You just need to make sure that you do it before the sim lab. Also, this document right here, this document is your labor and C-section. So during our simulation lab, we're just going to review these things, because when you go to the hospital, you need to know what are contractions, what's true labor, what's false labor, and what are the stages of labor, and what happens during a C-section. So you need a little bit of preemptive material before people start going to the hospital. The reason why everybody does it up front is because we have to test on it. It's not fair to test some people early, some people late, and not everyone got the information. So the first week is hectic. Yes, I 100% agree. But after that, you have all of your sim labs done, and you won't have, you will have your sim lab 3, which will be a little bit later. But you'll have sim lab 1 and 2 done. You've got to do fetal monitoring. Here's the document. Here is the simulation quiz. And again, you'll watch this. These videos are not too long. This one's 6 minutes and this one's about 30 minutes. And you need to sit there and listen and take the quiz. And again, you are it's easy for you to get 100. You just have to go back through and look at the information. And this has to be done before the simulation. And then later, okay, so you guys, after you do, so I'm going to do this one. This one is the cold stress. So I'm going to do fetal monitoring, and I'm also going to do neonatal cold stress. So I want you to make sure that you look at this document right here. And, and you look at what these vital signs are supposed to be, because you're going to have a quiz in the actual simulation. We make you do a quiz to try to help you to memorize a little bit of this. But here are the questions. I even have the questions that I ask right here. What's the temperature, heart rate? What is it supposed to be? What is non-shivering thermogenesis? So you guys, and then we're going to show you how to take a heart rate, how to rapid neonate, all of those things in the simulation lab. So you're going to have to take this neonatal review first before the simulation. So you have 3 quizzes, 3 sim lab quizzes that you take. And again, that's counted in your 8 hours of simulation. Then you're going to go to simulation for approximately 2 hours. And then you're going to have a third check off. So you're going to, Lisa is going to teach you how to do this head to toe exam. And I want to show you this. We are going to check you off that you're able to do the head to toe exam. This is exactly like it was in health assessment. It's a little bit easier. I have everything on here for you. Auscultation, we don't do 8, 8, 3, and 2 lung fields. We only do 4 in the front, 4 in the back because women's lungs are compressed. But if you hear an adventitious sound, of course, we would do everything. Look at the heart, listen to the heart, shows you how to do it. Look for edema, assess for Homans. We'll talk about that more. Auscultate the abdomen for bowel sounds, and these are on the outer edges. Complete the fundal height and Leopold's maneuvers, which Miss Dote with Weight will show you. DTRs, patellar, one upper and one lower. Colonus, which can be a very devastating neurologic sign for women's health. Pupillary responses, cranial nerves, conclude, and foam out. So on your SimLab 3, you'll be asked to do this, and it's pass-fail, and you need to be able to do that in order to pass the class. After SimLab 1, you're going to go into Shadow Health and do uncomplicated delivery because we did the stages of labor. And then you're also going to do Shadow Health. These are both simulation labs. The non-reassuring fetal heart tones, and those will be due on the 22nd. So again, these are due before we start class. These are due before your sim lab. Okay, head to toe maternal assessment, fetal monitoring, and newborn review. And then these will be due after simulation labs. I do want to say, so this is the first week. The second week is Martin Luther King holiday. And so all of the classes that I have for OP will only take these quizzes. This is a calculation. Well, this is actually just a documentation of pregnancy, so it's not very difficult. This is simply a calculation. This is about a 4-minute video that talks about RH incompatibility. These are the just regular lab tests that we do in pregnancy, and I just want you to go ahead and get a handle on these. You'll be able to take these quizzes up to 3 times again. And this is just your CBC, your H&H, your syphilis titer, your pap smear, just things like that. It's just a review of just the routine labs. And then we're going to go ahead and start with breastfeeding. And then, of course, I'll review these when we come back. This information will be on your test on January 23rd. And then I'm going to start collecting information for the test map here. If you have any questions, please feel free and contact me at jabaker@unf.edu. Thank you.